Hello everyone, my name is Sunny Thompson. I am the nurse manager on the pulmonology unit here at Healing and Love Acute Care Facility located in Dallas. We are one of the largest faith-based organizations of acute care located in North Texas. Our patient population includes both acute and critical care patients. We have a patient population of adults. We don't have a pediatric facility that is newly diagnosed asthmatics, problems with North Texas air for congestion or allergy related pulmonology issues, patients with COPD that have had that for a long time and may be experiencing some complications from that or an chronic acute COPD exacerbation. We also have a skilled nursing unit for patients with an extended stay of maybe 6 to 8 weeks that need some additional care and explaining of their home medications, how to use their inhalers, barometers, increase their lung capacity, or just to maintain what lung capacity they may have. We also have a team available for patients that may be needing long-term care facilities. That team will include social workers, extenders, which include nurse practitioners and nurses, that will help facilitate a move for the long-term care patient to find a facility that meets their needs, whether that be close to our location or a location for the patient, because we do have patients that are coming into us from surrounding cities that receive care. Now we'll discuss the chain of command for nurses at our facility, and we'll do that from the top down. We'll start with the Chief Nursing Officer, or a CNO, as some of you may know them as, the director. Then there's a manager, 1 or 2 supervisors per shift, a charge nurse, and the bedside nurse, which is the face, eyes, and ears for every patient. Patients look for anybody to walk in the room to be a nurse, but specifically the bedside nurse is kind of the advocate for the patient. Next, we'll discuss chain of command during a mass casualty. A mass casualty is something that no one looks forward to having to deal with, but it is an actual reality, and there has to be a protocol in place for positions, jobs, and just every day of what to do should that arise. There are only a few individuals that are actually allowed to activate a mass casualty. For us, that would be the company president, a facility director, or the CNO, whichever one of those is available. We do activate using a system throughout the facility of a paging system and a color-coded system that will allow, once it's heard, for all staff members to know that a mass casualty has occurred. Back to the chain of command, one of these people, the company director, the facility director, or the CNO, would first contact the director of the unit. Then the director would contact the manager. The manager contacts the supervisor or supervisors. The supervisor then contacts the charge nurse, and the remaining staff and bedside nurses are also notified. The supervisor and the charge nurses are readily available during mass casualties. We know they're on the unit, and they usually would act as the immediate incident commanders and delegate whatever task at that moment as needed until the manager or director arrives on site, if they're not already there. My role as manager would not change much during a mass casualty, as managers are there to direct patients and families and the unit and make sure that they are harmonious on a daily basis. My primary goal, or my primary difference in my role, would be to personally and physically help with relocating and moving the patients. That's where I will be more involved in helping the staff members from my everyday position. In an effort to maintain patient safety during mass casualties, we do inform the patients and families of the need to move or relocate, stressing urgency but not to incite a level of fear. We would appoint a specific staff member or team of staff members to move the stable and ambulatory patients first, because that is the safest and the most efficient way to get the majority of patients out into a safe place. We do maintain an adequate amount of monitors and oxygen tanks on the unit that can be used for the critical patients during disasters or mass casualty. There are group of team members that will be appointed to the critical patients and will be moved systematically and efficiently to the necessary locations. I do hope that this video has been helpful and informative to you. And should you have any additional questions, you can contact our administrative office at 1-800-555-LOVE. Thank you so much for watching, and we do hope to see or hear from you soon. Thank you.